Hi, I'm Kyan Safavi. I'm the MGPO Healthcare Policy and Management Fellow, and I'm excited to be joined by Marjory Bravard, who's the Inpatient Director of Medicine, and Ali Raja, who's the Executive Vice Chair of Emergency Medicine. We're talking today about the new MGH Admission Service Determination and Patient Placement Guidelines. And this is a collaboration between the MGH Capacity Operations Committee and services and departments throughout MGH. The aim of which is to really increase the timeliness of care that we provide our patients. So I was going to start off, Marjory, by asking, why were these guidelines created? What specifically do they hope to accomplish? And who should use them?
So the guidelines were created to tackle the problem of patients who gets really slow disposition and plan about where they should be admitted because there's not good clarity around which service should admit them. And the guidelines were made in conjunction with the leadership from the departments that are included, including the chiefs of a variety of departments. In general, the guidelines for a patient who comes in with really one problem should just make the process of deciding which service they go to quicker. And with patients who either have multiple active issues or where it's not clear, there's some disagreement around the appropriate service, they should help clarify the conversation and then quickly escalate as needed to an attending conversation to make a rapid determination about the patient's placement. So if, for example, if there's a patient who has two different active problems, the two attendings may decide who will be the primary service and who will be the consult service, and so those services can quickly provide care for the patient.
Okay, great. Ali, as an emergency medicine physician, how do you think this might impact the care of your patients in the ED?
That's a great question. I think the most important part of this is that a lot of these discussions often happen in real time. They happen in the middle of the night or during a really busy afternoon, and there's a lot of stress involved, not just for the physicians, but for the patients themselves who are waiting for these determinations to be made. And so they're subject to all the variability that comes with having individuals making these decisions in real time. Instead, what's happened is a lot of departments have gotten together and made these decisions while sitting around thoughtfully taking their time working through all of the details. And so instead of coming up with a one-off solution, we've got well thought out plans that are bought into by all of the chiefs of all of the services who are involved. So the best part about this is that we're going to have plans that are well thought out beforehand rather than trying to come up with one-off workarounds on the fly.
Perfect. And Marjory, I would break down these guidelines into three areas. One is general guidelines that really cut across services and departments. The second piece is more service-specific guidelines that tackle specific diagnoses relevant to each service. And then a third part that deals with special scenarios that require additional considerations, like adult psychiatric admissions, as well as ENT and ophthalmology admissions that we take care of in conjunction with our Mass Eye and Ear colleagues. So I was wondering if you could provide some highlights from each of these sections.
Absolutely. So the general guidelines refer to essentially patients who are returning to MGH for care following having received care. For example, post-procedural patients who come back with a post-procedural complication, patients who are returning either within 48 hours of an index admission or even 30 days, making sure that we understand how the discharging service should be contacted and involved in the determination of that patient's placement, and also some guidance around escalation if needed. And the service-specific guidelines are determined. The service-specific guidelines are determined with the leadership of those departments to be a list of diagnoses that they wish to be admitted to their services. And so those help clarify the patients either with one problem or multiple problems, so we can more quickly determine where they should go. And of course, as you mentioned, for our adult psychiatric patients and patients with ENT and ophthalmology needs who have more specific needs, for our adult psychiatry patients and our patients with ENT and ophthalmology needs, there's more specific guidelines for those special populations.
Great. And Ali, when should clinicians seek to access these guidelines, and where do they find them?
So all of our clinicians are going to be able to find the guidelines on ellucid. We'll have a link included in the text below the video. Just as importantly, though, these aren't guidelines that you want to access at the time that your patient is going to be admitted or for the first time when there's a patient who might come into multiple services. Ideally, hopefully all of our clinicians are going to be able to access the guidelines on July 15th when we go live. They're worth reading through, whether you are on an inpatient service here at Mass General or you're an outpatient clinician whose patients might end up on an inpatient service. For example, there are some patients who have classically ended up on the cardiology service who might now end up on one of the general medicine services. And so it would be really great for all of our cardiology colleagues to read through the guidelines so that they have a better understanding of where their patients might go. That's just one example, but it applies to all of the various services who are involved.
Great, thanks so much. And so, in summary, the new MGH admission service determination and patient placement guidelines will go live July 15th. The aim of which is to really increase the clarity around which service typically should admit a patient, and if there's still lack of clarity, how do we escalate that discussion to make sure patients get the timely care that they need. You can find these guidelines on ellucid, and as mentioned, there'll be a link on the email that contains this video. So thanks so much, and we look forward to seeing how this positively impacts the care we provide our patients.
Thank you.
Thank you.